Here for a daily 1 p.m.
Welcome to Healthcare Sucks update
We'll continue
live.
to do this every day until further notice, 1 p.m. every day. My name is Tim Killian, Killian. I'm a public information liaison with Life Care of Kirkland. I'm going to begin as I did yesterday with running down the numbers. After that, there were several questions that came up yesterday that I have additional information on, so I'll go through those and then we'll take questions after. Once again, I want to start by thanking the staff, the government agencies who are continuing to work with us to manage this situation. I once again can't stress enough that everyone who's working inside that facility is a hero for the work they're doing to take care of these patients. We'll touch on this. We did receive more staff yesterday, and that continues to rotate in. Once again, some of these numbers have not changed, but I will repeat them. The original number of residents on February 19th was 120. The number that have been transferred to hospitals since that time has increased by 4, so we are now at 58. There was a change of 4 from yesterday. The number of deaths remains 26. Patients who have died in the hospitals are 15. 13 of those have positively tested for COVID-19. The patients who have died in our facility remains 11. We still have no information on post-mortem tests of those patients who died within our facility. I will say that I have heard in the last few minutes a report that 2 more patients died in the hospital affiliated with our facility. We are on the phone right now with hospitals trying to verify. If they get that information before the end of this, I'll give that information to you.
So that information is not reflected here?
It's not reflected here. And it's a good time to reiterate, once they leave our facility, we rely on the hospitals to report back to us what has happened, and that doesn't always happen immediately. The current number of residents that are still in the facility dropped by 8. We have 55. I know that 4 of those were because of transfers to the hospital. I don't have an exact understanding what the other 4 are, but we are now down to 55 patients. We still have 6 patients who are exhibiting a level of symptoms. Yesterday afternoon, we received enough kits to finalize all testing within the facility. That testing is still ongoing. We have 11 more of those tests complete. I do want to stress that we still have received no results back from those tests. Those are sent off site once we do the test, and we have not yet heard any positive or negative, any results from patients tested from within our facility. The total number of residents with positive tests, and this includes those who are in the hospital, increased by 1, so is now up to 19. Our employee numbers have not changed. We began with 180, 70 of whom are showing symptoms. And that's it for the numbers. So before I take new questions, let me try and cycle back to some of the questions that came up yesterday that I have answers from. There was a question, where do our kits come from? They have been coming from the Washington State Department of Health in coordination with different agencies as well. So it's hard to pinpoint exactly, but primarily our test kits are being delivered by the Department of Health. But I know they are working with HHS and CDC as well. Have employees been hospitalized? We are aware of 3 employees who have been hospitalized. We know that one of those has tested positive for COVID-19. There was a question about what are the symptoms that what's the level of symptoms that we deem is acute enough to transfer a patient out of our facility into a hospital. The shortest answer is that is a judgment call made by our nursing staff. It does include 3 specific symptoms. It's a combination of a level of cough that's troubling to them, a shortness of breath, and a temperature over 101 degrees Fahrenheit. In the end, it's hard to say that there's a checklist because this is a judgment call that those nurses and doctors who are taking care of the patients need to make with each individual patient. There was a question, did those who die, were we aware of underlying health conditions? Generally across the board, anybody within our facility has some level of underlying health conditions, so that's always going to be the case. We still have not, of the tests that we're doing, we still are not testing our employees inside. We don't have test kits to do that. That's an ongoing discussion that we are continuing to have with the various agencies, that we would like to be able to test our employees who are here working every day as well. Yesterday, I think I mentioned, or it might have been said offhand, that the additional staffing came from CDC, places like that. Is not true. The staffing came from the U.S. Public Health. They're U.S. Public Health Commission corps officers from HHS, Human and Health Services.
Did you say 4 officers from HHS?
Not 4. It was their U.S. The staff that have come are what's called U.S. Public Health Commission corps officers from HHS. There was a question yesterday about what supplies, how are we doing with supplies. We're going what's called a burn rate through our supplies rather quickly, but as it stands now, we have been receiving continuous resupplies from various sources. As those our suppliers, our commercial suppliers, are continuing to feel the stress as they have to send more and more orders out. This morning we did receive from the Department of Health another supply of what's called PPE, personal protective equipment. So we still have those, but we do have some concerns that going forward that will get harder and harder as more facilities continue to ramp up their needs as well. And that's it for the list of questions from yesterday, and I will take it, open it up for other questions now.
I talked to a family member today who said that the daily calls from the people in Tennessee have stopped. So what are you doing actually to reach out to families and keep them apprised of conditions?
I'm unaware that they have stopped. I don't think they've been stopped for any particular purpose. I will double check on the status of that. I will continue to say any patients that can be given to this facility and we feel like we're still in triage in what's happening here, that we're still working on the initial problem, and sometimes updating charts and informational things may take a back seat to other needs that are happening within the facility, and that may slow things down at certain points. There's a hierarchy for us of what's important to do right now, and obviously taking care of the patients on site with a diminished staff is taking priority over all other things, and it may be that has just slowed down for those reasons.
What are you doing in terms of trying to reach out to the family members to reassure them? We talked to a nurse who's here who says she's been making calls herself. There have been some concerns that some people have mentioned about not getting showers on a regular basis. It turns out they probably never got showers on a regular basis. So how are you communicating with the families what you're doing during this triage time?
What I can say is what we're doing is the best we can do, and taking the time that we can to focus on the patients. And when we can reach out to the families, it's absolutely important to us to do that as well. Again, there's no specific effort to not reach out to the families, that if there's ever any delay or any lack, it's just because we have limited bodies who are doing more work than usual and have less and less time to be updating people. But when we can, and the more help we can get to do that, we keep looking for that help as well. We, at some point, as you know, we were also trying to coordinate that from the corporate offices in Tennessee. That presents its own challenges. It would clearly be better if that could happen here, but we are down social workers here. We don't have what we would have in a normal staffing time, people available to make those phone calls within the facility. And because of that, there can be a delay and a complication of gathering information between what's happening here today and what's being communicated out. So it's I guess I would just ask the understanding of it may sound like an easy thing to, hey, tell me how my mother's doing. This is my second day of just putting these numbers together. It's not as easy as it sounds. Getting all that information coordinated, because it can change, because staff is busy doing any number of other things at any given point, it can be very difficult to get all the information
How
together.
quickly are the time periods happening from when someone starts to exhibit symptoms and they're hospitalized and in real critical condition? Is there a pattern to how quickly that happens?
As I said yesterday, we have found this to be troubling and volatile, unpredictable. It can be, we have seen as little as 1 hour somebody exhibiting no symptoms to going to symptoms that were severe enough that they needed to be transferred to a hospital, and then within a short amount of time, that patient dying.
Do you know how long that period was from those first symptoms to the person passing away in that case?
It's a matter of a few hours.
But that's not the case for everyone.
Not for everyone. So that's why we say it's unpredictable for us, because it doesn't always exhibit that way. But it was surprising and shocking to us that we have seen that level of escalation of symptoms to death that quickly.
So if I
Did we
have
hear Friday about
ventilation
this
system I asked about yesterday. So is it a shared ventilation system? Can you actually?
Sorry, I didn't get that question answered, but again, they assure me that this is a facility that is used to influenza outbreaks. I will not say definitively at this point, but I know that the facility is built with the understanding that we do treat infectious disease. But I will clarify that as soon as I can.
And
Sorry.
just about the return to response time for the test results, how quickly are people getting, families are saying they're getting different responses. Is it 48 hours that you should get test results, or 4 days?
Well, we have yet to receive a single test result from patients here. So I can't speak to the timeframes that happen within the hospital with people who are there, but as of today, we just started testing on Friday. So let me just clarify that. But we have yet to receive any test results from those tests.
Transferred out, but test negative. Will they come back here, or?
That will be made on a case-by-case basis.
Tim, we heard on Friday about the CDC sending this strike team. Do you have any more information on this strike team? Is this strike team here? And do you have a head count or a number as to how many additional people are now rotating in and out of the facility?
I don't have that specific number because we haven't met them all, but they are working, as I understand, they're in shifts of 3, or there's 3 shifts throughout a day, and they're rotating in at different shifts, but I don't have a specific number yet of how many that is.
And then about this strike team, I know it's kind of a buzzword that we continue to hear. Do you know anything more about that? What their role will be, or what you've heard about this?
No, they're there already. Members of that team are there already. These are nurses, CNAs, and doctors who are rotating in to help our staff, and it's been greatly appreciated. We're very thankful for the help that they've given us.
Do you
Do you have a
ballpark at all
number?
on the number?
I don't have a number.
I want to ask another question. I know you have more tests now, enough to test all of the patients. Do you have a timeline for when all the patients will be tested? I'm communicating with someone who says that her relative has not been tested.
So as of about 20 minutes ago, we had 11 of those tests left to do. We expect that will be completed by this afternoon, and all tests will be in.
We saw a
But
woman,
results, again, as I say, we have no control on how soon those results are coming back to us.
but you haven't gotten any results yet, you said.
None.
We saw a woman just before 3 who was put in an ambulance. Is there a way for us to know whether when we see people leaving that they're actually going to the hospital or maybe going to some other location? But does the ambulance indicate they're on their way to the hospital because of the coronavirus?
Generally, that's true, but I can't say in every case that's absolutely true. And it would be hard to update immediately because of HIPAA regulations as to what exactly is happening with each individual patient.
So, the county released around 2 additional deaths.
Yeah.
That were associated with the people passed away earlier. Are those the 2 deaths that
We're checking up on that. Those are the deaths I'm checking up on right now. Yep.
yesterday you mentioned that you've been asking for help every 5 minutes. And given that Lifecare of America is a $3 billion company with 200 facilities, 40,000 employees, Why are you not immediately using your ample resources to get the best advice and for the patient to become fully staffed? Why are you asking the government to do this job?
In part, it has to do with licensing of nursing and doctor staffs who are able to come in immediately and work in these facilities. But the other part of that is our other facilities also have needs and are not able to abandon their patients and needs at the same time. So it's more complicated than just shifting around. We are looking for different employees here within the state that can help us. It's an ongoing issue that we continue to work with. I would just say there's no simple answer as to why can't you just get 20 people. It's more complicated than that, especially in a facility that's compromised. And so we're doing everything. All I can tell you is we are doing everything we can within the framework of everything you mentioned to be able to supply and help our facility here.
Is there any option for patients who are well to transfer to other facilities in the state?
That's an ongoing discussion with each patient and the family members.
Are you going to reimburse the government for these costs?
Are we going to? I can't speak to that.
Tim, is it concerning at all to you? I mean, here we are, it's been dubbed the epicenter of at least Washington State, that you can't even get the test kits for your employees, and we're talking about the problems, elsewhere in the country. I guess, can you speak at all to that? I mean, you can't even get those test kits for the employees here in this, where we're seeing so much of this.
Yeah, it absolutely, it's concerning to us, but we also are continuing to work with the various government agencies who continue to assure us that more kits are coming.
We keep hearing.
Swabs are one test kit, and if they can test multiple patients per kit.
I will ask, my sense is that each kit is for a single patient. The number of swabs off the top, I don't know that, but I can get exactly what each kit contains. We did have a couple of kits yesterday that were either incomplete or weren't able we weren't able to complete the test using the kit, and we did get additional kits to cover that.
Are there any plans for post-mortem tests at this point that you've heard, and what has the time frame been for getting people tested and then getting those?
We've asked for those results. Again, we don't control whether or not that decision gets made, but we would hope that there are post-mortem tests being done. But we have not been getting, as I said, of the 11 deaths that we have had in facility, we have not received any information on post-mortem tests. And so for us, that's why I use the caveat that we can't say that those 11 who died from complications to this virus, but we would like to know that. We are asking for that.
Are you also asking, now that you've gotten the tests for the patients, to get enough tests for the staff as well?
That is an ongoing discussion of how best to manage our own employees and their own exposure here. So it's probably not as black and white as, hey, will you do that? It's an ongoing discussion that we're having with the various agencies.
Well, it felt when you asked us about it.
The numbers of people and individuals who actually visited before the outbreak was known.
I will say that right now that is not our priority, nor do we have the time to be able to go back in time and do that. As I said, we're still in triage mode. Perhaps there'll be a point at which this slows down. We would encourage anybody who visited this facility and feels that they need to visit their doctor to do so, to have a conversation to see if they can get testing done for themselves. But we at this time do not have the additional resources to go back and see what records we have to indicate who may or may not have entered the facility prior to this last week.
So just to understand, do you want your staff to be tested? Like, do you want test volumes?
We would like to know how our employees are doing. Again, that'll be an individual decision made with each employee. But have we demanded that this happen? No, we haven't made that demand. But it's an ongoing discussion that we're having.
And the folks who were taken to the hospital overnight before, those were definitely because they exhibited COVID symptoms, coronavirus symptoms, or was it for something else?
As I said, all patients here have because we haven't received test results for any of the patients here, there were symptoms, but we can't, some of them may just have influenza and may be exhibiting similar symptoms. So I can't say definitively which were exactly COVID related,
It
but
wasn't that they fell down or broke and did something
Correct.
because of the COVID symptoms.
correct.
Has anyone recovered?
Speaking of who,
The patients who have been tested positive and have gone to the
I don't have any information on. Again, what happens once a patient transfers out of our facility, we don't have direct access all the time to who has and who hasn't left the hospital. As soon as, if I get that information, so in fact, this is a good time to mention this. I've made a decision. Several of you and other national media have asked me for individual interviews, and I've made a decision not to do that. If there are questions like this that are important, I will be sending out what I call an addendum to the press list that will update information if I think it's important to update it prior to tomorrow's next briefing. But I've made the decision not to segregate my information into individual interviews, just because I think this issue is important enough that we need to be sharing it generally across the board.
Some families, Tim, are asking why you're meeting with us and not the families.
I play a different role. My role is for public information, specifically press related. We have other people within the organization who are focusing on information to the families. But the families distribution list is now going out with our press distribution list. Whenever we send out a document such as this goes to the family list as well.
Can you explain why or why not a mobile quarantine unit is not a viable option here?
I can't speak to any of those, why those decisions have been made to not have those on site.
Why were new residents still being admitted after the first resident tested positive on February 19th?
That first patient did not test positive on February 19th. They were transferred out on February 19th. Testing was done, and we didn't get those results until a later date. So we didn't know. We didn't know. I don't have the exact date, but it wasn't. It was. I've been working on trying to understand that exact date, but there was a time period of days before that patient left the facility, and we understood that they had tested positive. So at that point, we had already. It would have been common for us to have an influenza type situation with patients, and we treated the facility in the same way that is very common for this facility to treat patients.
I want to piggyback off of that. The 10 days that it passed between that patient being transported out and then the decision being made to close the doors, turn away visitors, what was kind of the straw that broke the camel's back to make that decision to shut this place off essentially from visitors, vendors, volunteers? Do you have any more information on what the final call was or what?
It's been an ongoing discussions between government agencies and our facility, and
there wasn't one particular.
There wasn't particular. It was an escalation of this was new. We were trying to figure out what was going on. We had limited information in the same way that we still have somewhat limited information on how many of our patients here are. We don't have test results aren't coming back to us immediately. So there's a lag time, and that seems like it's getting shorter. But at the beginning, it was just a lack of information, understanding how soon we got that information and how to act. So.
If the staff can't be tested, are you concerned that some of them might be taking the virus home to their families and to whatever places they visit?
As I said yesterday, our staff are trained in generally, for example, related to influenza. They're trained how to handle themselves within the facility, how to handle themselves when they leave the facility. Sometimes they understand that it's in their and their family's best interest that they sequester themselves in a bedroom. We expect our staff are following the same training guidelines that they've had previously. We are still in discussion with the CDC on if there are other measures that need to be taken in this specific instance with this specific virus, and that's an ongoing discussion.
Have you established any different protocols as far as the transferring of garbage? For example, there was a recycle truck last Thursday during an interview that came and went. Is there anything unique about your?
I can't speak to any changed procedures with garbage, but I can ask that question. I will ask that question and try and get an update.
We saw people
protocol? Is that where that stuff's supposed to go?
I will ask to see if that is protocol, but that's the exit point for their last leaving of the facility, but I'll ask to see if there's anything we need to do or anything that's being done specifically with that.
I've seen family members enter and exit the facility visiting in the last few days. So it doesn't seem like it's really locked down to visitors.
It is locked down to visitors. I can't speak to each individual who may have different reasons why they have entered. But in general, it is locked down. Is it locked down? It's not locked down like a prison would be locked down, but we are not allowing non-essential employees or other visitors to enter the facility at this point.
We're being told that different entities, churches and the like, are also delivering food and that sort of thing. Do you have any sense of how much of that is happening?
It has been happening, and the staff has been very grateful for the support they are receiving from the community. In terms of numbers, I don't have any information on that. One more question, and I'm going to go.
Staff members work in any other facilities in the area, like do they rotate, or do they go back and forth to do per diems at the hospitals?
There's discussion and ongoing about rotation of staff, but I don't have any specific information on how many have actually come into our facility from other facilities.
Do they routinely do that? Like before this all broke open, did they do that anyway? Like kind of pick up weekend shifts?
My understanding is that wouldn't have been uncommon before. I know that there's more complication around that now. Again, this gets back to it's not as easy as just transferring employees from one position because of exposure issues and moving. But at the same time, we're balancing that with a very real need to have more hands on.
But I'm sorry if my question is unclear. But what I mean is it possible that some nurses, for example, who work here also do part-time at other nursing homes or hospitals, like on weekend shifts or nights, just to make more money or to do
I'm saying
whatever?
prior to this situation, that wouldn't be uncommon. I don't know. I don't have any specific numbers on what is happening with that now, but I will check and get an update.
But I
on
mean, is it possible that any of these other folks are you guys looking at that as a way of this
Absolutely.
spread here, or
We're looking at any options possible to get more help within the facility.
Tim, one last question for the families, and that is, when are they going to be able to get in to see their family members in the home?
I don't think that any decision has been made on that, and we are not in a position, as I say, while we're still in triage mode, we're not in a position to make any guarantees about specific dates.
Okay, we got a tip yesterday that the director of nursing care resigned last week. Any truth to that?
I've heard nothing about that, but I will follow up.
So also, if you could get the number of people who've been coming in to help.
Just a minute, guys. I'm going to pause this and I got a comment for you. Next video is Oregon governor, but we're going to do it separately, guys. TV's doing something wonky, guys. All right. We're going to go ahead and go with this. First, I want to make it clear it's not up to me at this point because of the situation and the deaths and stuff. I'm going to leave it totally up to the family members to ridicule on this situation or to nitpick or to give their opinions, because a lot of people have been saying good things about life care. So out of respect to the ones that have passed and the ones that are living, etc., the family members, I truly, really do this from my heart and to those people, and I'm sorry for your loss. I hope America learns from what's going on here, because it's coming to a neighborhood near you, if it's not there already. With that said, I picked up on some very interesting subject here. He gave away something that we all need to share. That death within minutes or hours. Death within basically hours from the time that it gets to a certain point it's almost like there's no turning back. You're heading down to see the Grim Reaper, unfortunately, and I hope that don't sound rude, but that's, I think, a way to say it, and that's not being addressed by the government. Not on the governor's level, not on the president's level, not on the senator's level. None of them bozos, and I do say bozos at this point because they have dropped the ball, all of them as a unit. Death within hours, guys. We need to keep that in mind. So they need to quit monkeying around with this and get on the ball. WHO, this is to you. Pandemic. Quit monkeying. Release the funds. You're not going to get the money in June. You guys that have, with World Bank, that bet on the stocks, the death stocks, we are now calling them, you lost. There's a pandemic. Get over it. Call it a pandemic. Call it what it is. It's time to move on. With that being said, we heard a lot of things about people coming and going there. That's serious. That needs to be not happening. I seen him with no mask, whether it means good or bad. Security guard over on the side back there, no mask. I did notice an employee way back that went out to apparently the garbage area, had a mask on. On this, tracking down the people that have come and gone in the past, this is to you, governors and FBI. You guys can track down anybody who drops a cigarette butt in a crowd. So you can't tell me that you, FBI bozos, after what we've seen, the lack of during the last 3 years and how you have botched things, and that goes for Department of Justice involved with this too. Get off your butts and do the right job. Track down who's come and gone from there. Get on it today. There's no use in you neglecting and putting us at risk. You know, just because I'm a state away doesn't mean nothing. Washington's only, where this is happening is a few hundred miles from where I live. And that's not the point. The point is that this could have already traveled all over somebody could be traveling all over the United States, or many people could be traveling, and then meeting other people, or like I said the other night, going in to get groceries and spewing it all over things, and then those things, people touching them, and this is how this is going to spread. I don't feel as though the government is controlling or doing their part in this. I don't know how to emphasize that. I am going to ridicule them because they need ridicule. Another thing, if you're keeping up on it, Italy is doubling, guys. France just almost is at the doubling point. So we go to the pandemic situation, we go to the movie type thing.